Good evening, everybody. It's Dr. Will, Skin Wizard with Natura Dermatology and Cosmetics. Welcome back and thank you for watching this video. I want to talk to you today about under the eye circles or dark circles under the eyes known as chloasma. There's a lot that happens underneath the eyes when you see these dark circles, and I will attempt to capture as much as I can right now to get you informed on what works and what really doesn't work for underneath the eyes. So let's get started. So when you see dark circles underneath the eyes, what is happening exactly? There are two things. The first and the most obvious is that as we age, the eye socket actually rotates backwards and inwards into your skull. So it becomes sunken. The bone, the orbital hollow, actually rotates inward and backward. What that means for you is that the brow actually comes forward, and that creates a little bit of shadowing. So a component, first of all, of what you are seeing is a volume loss phenomenon. What that means for you is that we can actually use fillers in that area to place deep underneath the muscle to get that volume, that concavity rather, to become a little more convex and reflect light back to the eye. I always get those two mixed up, but nonetheless. Concavity, so the hollowing underneath the eyes, also known as tear trough deformity. We can fill that in, get that area to lift back up, and we can reduce the shadowing that results from that loss of volume in the orbital hollow or the eye socket in layman's terms. So that's number one, is volume loss. Number two, the second thing that happens is that the epidermis or the skin in the area does become thinner. The lower eyelid skin becomes thinner. In such, that causes the muscle underneath to become a little bit more visible. The muscle allows you to do this. Close your eye really tightly. This is called the orbicularis oculi muscle. If you look it up on Google, it is a sphincter-like muscle that allows you to close your eyes. That muscle becomes more visible. That muscle is red in nature, maybe slight deep red, and that reflects light back to the eye through that thin epidermis or that thin lower eyelid skin. It's being kind of a brown color. What else is going on underneath there? Not only is the skin thinning, the muscles becoming more visible, but also there is congestion in the area. A reduction of the rate of blood flow is what congestion is, and that happens to result in leaking of blood through the capillaries in the lower eyelid skin. When red blood cells, remember, these guys contain iron in the form of hemoglobin to allow you to carry oxygen in your blood. When those guys leak into the dermis, which is the connective tissue that the skin lies on, remember, that's our scaffolding. That's the foundation of our outer epidermis that we all see by looking in this mirror and at this video. You see epidermis. Underneath is dermis. The leakage of those red blood cells into the dermis leaves behind the iron, which is a brown tint, adding more to the brown discoloration that you see underneath your eyes. Last but not least, there is some hyperpigmentation, elevation of the melanin concentration in that thinned eyelid skin underneath on the lower eyelid. That results, again, in more brown discoloration. So just to recap, you've got several things happening that result in those dark circles. We've got volume loss, number one, that we discussed, that we can actually correct using our fillers on the market. Number two, we have thinning of the skin on the lower eyelid, resulting in number three, visible muscle underneath. Contributing to it is number four, congestion in that area, which results in leakage of red blood cells and leaving behind iron pigment stain in the dermis, which is the scaffolding of the skin, causing brown discoloration. So these are the four key things that result in those nasty dark circles that none of us like. Again, fillers can correct this. To address the other components, there are topical agents that will reduce the congestion so that you don't have as much leakage of red blood cells and deposition of iron stain. You can use bleaching creams that have kojic acid preferred. I have a product line called Natura MD Sciences. So Natura, N-A-T-U-R-A, MD Sciences, that reduces the discoloration in the form of the melanin, as well as reduction of congestion, decreasing that leakage of red blood cells. Again, Natura MD Sciences, it's called Erase. It's a 2-week treatment that you can use, so congestion of the vessels. Also sunscreen, make sure you use a really good sunscreen in the area. There are some designed for specifically underneath the eye, and if not, a really good concealer is magically a sunscreen as well. If you have any questions, don't hesitate to comment underneath this YouTube section. You can also message me on Facebook. Just hashtag Skin Wizard, you're gonna find me there. Thank you for watching the video, and I look forward to seeing you guys again soon. Thanks so much. Bye-bye.